Good afternoon. Thank you for letting me present to you. My name is Allison Freelou, and I'll be presenting today about music therapy and education. And don't worry, I have the camera angled to where they can't see you. You're just in the room. But thank you for being here. So, music therapy and students. Music therapy, by definition, is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. In other words, it's the use of music to help individuals with therapeutic needs. I will be getting into some of those needs later in the presentation. How it works. A music therapist can use different instruments and exercise with patients or students in a therapeutic setting to help them in many ways. They can use different rhythm exercises to help with their motor skills. They can help memorize words and terms with different songs. There's different calming benefits to music, which can help with different patients of different needs in hospitals and different things like that. Common uses for music therapy. One of the most common uses is to help treat anxiety and depression. It can also help the elderly with dementia and Alzheimer's disease. It can help cancer patients during treatment to boost their morale and also to give them calming benefits. It really helps give endorphins in the brain to help them put them in a better mood. So when they're going through the tough time of all their treatments and everything, music can really help with that. It's been shown to help stimulate growth in premature infants. So a music therapist can work in the NICU unit to help stimulate some growth. And special needs patients and students who are on the spectrum, it can help calm them during very stressful times if they're having an episode or something of a very stressful time, and they can be calmed by the music. Most common uses for students in special education with music therapy is to help facilitate movement. It helps provide avenues of communication, so it can help them communicate better with their teacher or with the other students. It helps increase motivation in the students, so it boosts their morale and really gives them more confidence and helps them keep going. And it provides a way for them to express their emotions and their feelings. Some connections between music and education. First, I would like to note that music therapy or therapy using music is not meant to replace a child's special education curriculum, but instead it's meant to complement it. So it's meant to be used as a tool to help along with the other special needs and special education therapy. So it is not meant to replace it, it is just meant to be a complement to that. So certain connections between music and education. According to various research, music therapy has been proven to have connections in the following areas: singing and speech. So it can help students with their speech, just like speech therapy. Music therapy can help them communicate and speak better because of the repetition. Rhythm and motor skills. So the rhythm exercises can help with their hand and eye coordination and their motor skills. Lyric memorization and memorizing academic material. Just like I said before, you can really help them memorize different topics and different terms by using different songs and make it a little easier for them because it makes it more fun. And listening and increased focus. So I think that's pretty self-explanatory. Okay, so some of the types of disabilities that music therapy can help with and been proven very helpful is autism, cerebral palsy, childhood apraxia of speech or CAS, learning disabilities, asthma, ADHD, and students with depression. The use of music therapy in the classroom. The use of music therapy in the classroom does not only benefit the students with special needs or special education students, but it can be beneficial to all regular ed students as well. Music therapy provides a way for some students to learn that they have never had before. It just provides a different way for them to learn. So I have some videos that I'm going to show, just some examples of music therapy. There's a music therapist that explains himself a little further, and then there's some examples of music therapy in the classroom. Here's our first video with the music therapist in a music therapy session with an autistic student.
but the clientele you work with is special needs, and those parents often have a completely different set of goals for their children than maybe other parents. They also have perhaps a different timeline. I know with Zoe, we don't know how long she'll be here, so we prioritize what we want for her life probably a little differently than a parent who expects their child to outlive them. And so with Zoe, I want her moments here where she can feel honored and validated and heard and understood, and where her spirit is free to be enlivened and be engaged in her way. And that's part of what music therapy does best for Zoe.
So that was my first example. That was a certified music therapist working with different special needs children, and as you saw, it helped redirect their focus and get them more engaged. It had them communicating when maybe they elsewise wouldn't be communicating. So it's very, very helpful tool to use in this modern day and age. The next few clips I have are just little small clips of music therapy being used in the classroom with not necessarily all special needs kids, but just students in general. As you see, each student has a different instrument and they're all working together to create the song. So that's really good to get all students engaged and working together. Here's another example of it being used in the classroom. See, he's using music therapy to teach them their action words and their different words that they need to know. This is a young kindergarten or maybe first grade class.
What is she doing? She is reading. What are they doing? They are talking. Hello. How are you? All right. Hands to the hands.
So, as I mentioned before, all these children are not necessarily special needs. This is just a regular classroom setting, but he's helping them in a way that maybe they wouldn't have learned before. So these songs really help them get a different form of education.
All right, last one. What are they doing? They are playing. They are playing a game. All right.
Okay, and this last example is another music therapist having another special needs child communicate with her through using music therapy.
The last one, and then we'll do the song, okay? So show me 3 snowballs. 1, good, 2, 3, good job. That's 3 snowballs. Let's try it again. Do you want to flip the snowball? Let's start with 2 snowballs. Kenny, show me 2 snowballs. Show me 2 snowballs. 1, 2, good job. That's 2 snowballs. Let's build a big snowman. All we have to do is add 3 plus 2. What does that equal? How many snowballs? 1, 2, 3, 4, 5. What's 3 plus 2? 5.
So as you can see, she was using music therapy to help teach him math skills and have him communicate the skill with redirecting it using music and props and other things to help him communicate. So the special needs child was able to do the math like a normal student would. So this comes to the conclusion of my presentation, and these were my resources that I used. If there's no further questions, then I will let you guys go. Thank you so much for being here today. And again, my name is Allison Freelou, and this was my presentation on music therapy in education. Thank you.